Welcome to JoyMed, the podcast of the Medical Society of Virginia. Here at JoyMed, we're delivering stories, wisdom, and resources about healthcare in the great Commonwealth of Virginia. Our mission is to celebrate the humanity of the patient-physician relationship. Say hello to the joy of practicing medicine. JoyMed. This podcast was recorded on January 28th, 2020. To get real live updates of bills that were discussed in this podcast, go to msv.org.
My name is Clifford Deal, and I am the 2019-20 President of the Medical Society of Virginia.
Clark Barano, Assistant Vice President of Government Affairs for the Medical Society of Virginia, meaning I run our Government Affairs team and I'm our Chief Lobbyist.
Lauren Bates-Rowe, Vice President of Health Policy for MSV. The Health Policy team works closely with the Government Affairs team to develop policies and public policies to solve healthcare issues in Virginia.
So yeah, we do spend several hours of our day down at the General Assembly building. Often, for better or worse, our agenda is dictated for us by what's on the committee dockets. We certainly have our agenda, but on occasion, we won't know what's going to be up in a particular committee until 12 hours to 24 hours later. And so once we have that information, we generally try to go around, speak with each member of the committee and or their staff. Myself and Tim Farber and Kelsey Wilkinson spend a considerable amount of time just trying to get the good word into delegates and senators' ears about where our stance are and why.
One thing that surprised me is that as bills work their way through, they morph and evolve. And so there's a constant circling back around through different offices. Sometimes you may see the delegate. Today we had a great conversation with Delegate Hurst from Roanoke with the students, but it may be his aide is Sadie. But on the other hand, we had a great dialogue with the aide to the majority leader, Senator Saslaw. So sometimes you meet the delegate or the senator, sometimes it's through the aide. One thing that always surprises me is the youth of the legislative aides, but they play a key role in the development of the senator delegates' policy development. So sometimes that's as or maybe more effective than talking to the legislator themselves. They're all part of the same team.
Policy really tries to help sort of fill in the gaps. And so, as Dr. Deal said, bills change, and Clark and his team will come back and say, we're hearing this, can you find out if it's true, what other states are doing, what's going on? And so we are almost a rapid response research team. And so we also then try to, problem solve and workshop things and say, well, we don't like this, but it's better than what's being proposed. So go talk to people and try this. Or, if a message isn't working, we work with our marketing team as well as the GA and policy team to figure out a different argument. A lot of these issues are so complex, and while we understand it because we understand healthcare, in a 2-minute conversation trying to explain, the complexities of healthcare, insurance reimbursement, et cetera, people's eyes start to glaze over. So we do a lot of that and then sort of help out, as needed with lobby days and sitting in committees and things like that.
Yeah, our policy department is fantastic.
Wait a minute, pause just a second. I want to give a shout out to Harry Gawanter, because if there was actually a pseudo member of the General Assembly team, he keeps us up to date with lots of varying perspectives, and I'm happy to report his bill on immunization reported favorably out of committee today from HWI.
Yeah,
Harry is a great advocate.
So let me give you an interesting bill that came up this year. So Senator Serville submitted a bill that would essentially require physicians to serve as a de facto expert witness. We were able to kill the bill. It raised a lot of concerns across the Commonwealth, including with us and the MSV. But it sort of begs the question, which is, how does the MSV develop its policy? Because there wasn't any particular policy on this particular bill, but the executive committee met, we opposed this, and move forward. But generally speaking, how we develop our offensive policy is through the House of Delegates, in which we, the physicians across the Commonwealth, vote up or down on shaping our policy, or through the specialty societies, where a legislative agenda gets advanced through various things, and then we working through the executive committee on a week-to-week basis. As the bills morph, we have to decide whether this is still consistent with MSV's policies or not.
Yeah, and I think that's so important too, because, and Cliff deals with this all the time, folks will ask, well, can't you, sway the committee to support or oppose this bill? And I'll say, our president and our executive committee do a great job. They know that, our bylaws say the House sets policy, and once we have a position, right, we follow that position. And it's why it's so important that we have people participate with us year round, because that's honestly how Dr. Gawanter got a bunch of our PBM policies. Was he said, I really care about this. We said, we don't have policy. He wrote resolutions, he came, he advocated it, and here we are supporting PBM bills. So it's super important, because then we can vet those things internally and decide our position together, and aren't doing it in front of all 140 legislators.
Amen.
I will say the executive committee, just so you know, is composed of a handful of folks, but they're from all across the state and all across different specialties, trying to make these decisions. Clearly, as a general surgeon in Richmond, my perspective is from that point of view. So we have folks on the committee who are from anesthesia, primary care, urban areas, other specialty areas, helping lend a hand to make decisions on where we ought to go as the issues evolve.
We vet every issue that might hit a bump quite thoroughly. They do a heck of a job considering it from all the angles and asking the right questions. It is quite a task. The trickiest thing is, as I mentioned, is just the nature of the schedule and physicians' livelihoods. Mm-hmm. We don't know when bills that matter often are in committee until the day before. Physicians cannot take off work willy-nilly. They have to treat patients. They have to save lives. It is not something as easy as filling a committee room. If I call a group of doctors on a Monday and hope they can get there Tuesday morning, they're all going to laugh at me. Other professions that we can occasionally bump heads with have that luxury.
The other thing I'd say is tell a friend, right? We have action alerts, we have newsletters, there's lots of stuff out there you can read, but we call our physicians that we work with closely, and they're wonderful and have been super helpful, and we want to expand that universe of folks we can call and say, hey, I know you have an example on this, or hey, didn't you have a friend who had a patient who had this happen to them? And so the more you can sort of expand our network of physicians who we can call on to ask to do something or give us information really is tremendously helpful. We need those stories and those examples to supplement all the research and things like that. There's, facts and stats are great, but when you hear about the real life impact to a Virginia patient, it makes all the difference.
If you're waiting for bills that matter, that you care about to roll onto the docket, I promise you they matter now as much as they'll matter a month from now. We also launched this year White Coats on Call 365. You're familiar with our lobby days, traditionally called White Coats on Call. And all it really means is that you are part of the special Delta forces of advocacy for the medical society. These are people who want to be informed, who want to know what's going on in subcommittees and elections and fundraising and kind of the inner workings of how we make our decisions and get to the points of where we want to be. So if you can sign up for that, you can go to msv.org/WCOC-365.
And I think to that point, it's one of the reasons why General Assembly session is so important, but also developing a relationship outside of General Assembly is just, I think, even more important. It goes really fast here, and people have committee meeting and groups coming in. And so, if you're a known friend to a legislator and they know what you do and know how you help that community, it makes your phone call, your email, your text just sort of stand out above and beyond everybody else's.
We have a full slate this session. Notably, are issues as it pertains to scope of practice legislation. Unfortunately, we've seen two bills that come to mind relating to the expansion of scope of practice, that being by the Pharmacist Association as well as naturopathic doctors. The Pharmacist Association has put in a bill that would seek to allow pharmacists to diagnose, prescribe, and treat for a handful of diseases, including the flu and strep. Having talked with our physician membership, there are several concerns we have with pharmacists being able to single-handedly diagnose a patient in the back room of a Walgreens, and the follow-up care that might be needed therein. So we're working actively to oppose that. There is also a bill to license naturopathic doctors. We have worked very hard to oppose that, with our concerns being that their education and training is not sufficient to safely and effectively treat patients. In the Senate, as we do when professions want to be licensed at this time, it has been kicked to a Department of Health Professions workforce review study. The last study they had was in 2005. In the House, the bill is still active. Our hope being to either kill the bill or similarly have the House divert it to a study.
One of the big issues that's before the General Assembly this year is balanced billing. And as you well know, when a patient is out of network, there are charges that may or may not be paid, and if so, at what rate. And there are various strategies going around to try to cap that rate and basically take the arrangement from a currently negotiated standpoint between the physician and health plan to where it would no longer be negotiated, and some of the bills are very disadvantageous to physicians.
Yeah, I'd say the biggest thing I think around balanced billing is there's a coverage gap for insurance companies, and premiums continue to rise, but yet they continue to pay less, particularly in cases of emergency care where patients don't have a choice as to who they see, and physicians, quite frankly, shouldn't and are legally not allowed to ask for a patient's insurance information during a medical emergency. So the solution we've been working on would make sure that patients are well taken care of, as well as the ER safety net.
Well, again, it's a team effort, and we rely tremendously upon the brains and the brawn of the staff. And by that I mean Lauren and Clark, the rest of the General Assembly team to be effective here. I'm here every Tuesday. Richard Such is the immediate past president, is here mostly every Wednesday. Other members of the executive team rotate on Thursdays to try to be here because we have patients scheduled, and we try to work this out to have time allotted. But it's certainly a challenge, and then it sort of continues all year long, again, with relationships with your legislators. But the reality is, I think our number one goal is, the safety and health of all Virginians, and this is why, while we certainly appreciate the efforts of our colleagues, both who are pharmacists and complementary and alternative medicine, why we defend some of the encroachments upon their legislative desire to practice medicine.
Yeah, and I think the big thing that we've seen, and just in my time at MSV that I've seen, is really the shift from physicians. And as Clark said, I think we're still working on it. We've got a lot of new folks, but you have to talk about why this is important to patients, why this is important to communities. There is a natural belief, and I've seen it in other organizations, the turf battle that you're defending, this because you want to make money, you think you're superior, and we all know that's not the case. And that's the reason why, it's so important that you reach out to the staff here at the Medical Society, you look at our talking points, you work through our materials, and you really engage with us, because we try to make sure that members hear the message that we know you all care about, which is patients and patient safety and the quality of healthcare in Virginia. And so that's why you'll see a lot of times, and I say this as the policy nerd of the bunch, we try to break things down so it's super, super simple. And if you want to nerd out, come join the health policy team. We've got a chair for you.
So certainly to the points raised, physicians have expertise, with the exceptions of a few healthcare providers in the General Assembly, as well as Siobhan Donovan, who is the only physician in the General Assembly. expertise when it comes to medicine is not always in abundance. So when we have issues such as the pharmacist scope of practice bill is a great example. It will allow for them to diagnose and prescribe for the flu. And the question is raised, well, how complicated or how complex is it to diagnose the flu? I don't know off the top of my head. Most of our staff would not be aware. We have to go ask our membership and the physicians, and it turns out the flu, being the 8th leading cause of death in the United States of America, is quite complicated. And so telling those stories, having those narratives, sharing that information with people, because the other side, be it pharmacist or any opposition, is going to say, this is no big deal. And of course, when they say that, the big deal is always relates to patient health and patient wellness and patient outcomes, and we need to be defending that first and foremost.
One of the things that comes up, I think, is that a perception is that the medical society it has a partisan role, and we are decidedly non-partisan, neither red nor blue. We are pro-medicine. And there sometimes there's some areas where we can choose, honestly, to not agree on. But there's a lot more common areas where we're looking out for patients and the health of all Virginians, where we can come together and agree. And so if there may be other political venues that we can have a different conversation about, whether it be climate change or gun control or other things. But the medical society is about the health and welfare of Virginians. And it's a place where all hopefully Virginia physicians can come together to agree upon what those things are and move forward in a productive way.
If you have issues you're passionate about, unfortunately we only have a certain amount of bandwidth in the General Assembly and Government Affairs staff. If there's issues you're passionate about, if you can't show up, let us know. We support quite a few bills. We oppose quite a few more, but we probably monitor even more than that. And so if there's something you want eyes on or follow up on or information or messaging, we're happy to serve at the pleasure of each of our members.
Well, and to that point, I think I'll take it as another plug for our House of Delegates process and our policymaking process. We have to work that out ourselves under the umbrella of the House of Medicine, right? You as an individual absolutely should find a way in a venue that's appropriate for you to do those things. But the way we lose is if all of the House of Medicine is not united. It is so easy to say, well, you're a surgeon, I'm primary care, and rural, urban, or profession versus profession. And when you all walk in there and say, I'm here for my patients today, it's my number one priority, and every physician that any member of the General Assembly or their staff interacts with is carrying the same message, it really means something. And so we do need to be united. If you want to have those conversations, please reach out to us. We can get you all set. Our annual meeting is in October. It's at the Homestead in Hot Springs. And it's our 200th. So you should come and have those discussions there.
How many bills are we tracking this year, Clark?
400 plus.
On average, that's more. What are we doing in a normal year?
Yeah, normally we've been somewhere between 250 and 300. So we're seeing more healthcare bills, I think, than since I've been here.
It is a new Democratic majority here in the General Assembly. First time in 20 plus years for the Democrats to be in charge, and thus there were a lot of ideas that were percolating for a long time, and now they're all the way alive. So we're seeing a lot of new faces in committees and subcommittees, and working with them actively to have the voice of medicine present in their considerations.
So one of our take-home points for today would be, please know who your legislator, your delegate, and your senator are. If you can politically support them, do something for them, have a relationship with them, whether you're in the same party or not. Thank you all very much for listening. We'd love to have you. I would say not only would we love to have you, we need you. The reason that we're effective in part is because we're a grassroots organization, and that means although we have a great team, you're a part of the team, and we need you down here. And certainly make phone calls, emails, your contributions, but we need you.
Thanks for tuning in to JoyMed. Don't miss out on an episode. Subscribe to JoyMed from your favorite podcast provider today.